Good afternoon, everyone. Thank you for joining us for this afternoon's session. So I've got Beth and Esma here. They are two of our PA students. So a PA is a physician associate. It's a relatively new career path in the UK, but sorry if I'm going to steal from your talk. But in the US, it's a massive industry. So it's starting to become bigger in the UK. Sheffield Hallam and Sheffield Uni run courses, and we take students from both. We have one real life living physician associate working in the trust, and she is lovely, and we would like some more at some point. The girls are going to do a little presentation, and then you can ask them some questions. And it's just another career path to highlight to you. In working in the NHS, and like I say, it's quite new, so you might not have come across it. I know I haven't come across it until the last couple of years. So we're just going to do a PowerPoint. We're going to do a Chris Whitty, and I'm going to press the buttons. They're going to be like, what did you do at work today? It's like Chris Whitty's show. So just bear with us.
Yeah, or I can start again. Am I being left with them? No, on the other side.
Can someone please tell me whether you can see this, because I now can't see the screen. Can you just say yes on your microphone, please? Just anyone. Is that a yes? There was a microphone on. Okay, we're going to go through it, and hopefully you can see, because you haven't told us otherwise. Okay,
so I'm Emma. I'm Beth. We're going to do a really short presentation, because we know you probably have a long day. So it's only about 6 slides, and the aim of it is just to give you a brief idea of what we do as physician associates, where we kind of fit in the NHS, and the entry requirements and things that you will need if you're looking to go into physician associate studies. So we'll do the questions and answers at the end. So I think that will be the most important bit for you guys. So this bit will sort of speed through, but if you have any questions, just make a mental note of the going through, and then just drop them in the chat or let us know at the end. Cool. Next bit. Oh, this is a little. So basically, this is to kind of give you a bit of information. It's okay. I can work with that.
Yeah. Okay.
About who we are and what we do. So we work alongside doctors and surgeons and all the members of the multidisciplinary team to provide medical care as part of the MDT. Usually we would have a medical supervisor. Normally that would be a consultant who would oversee us and we would report back to in terms of our management plans and the diagnoses that we come up with. And on the right-hand side, you can see the different things that we would get involved in. So, for example, taking medical histories from patients, we would do physical examinations, diagnostic, therapeutic procedures, etc. Next slide, please. Okay, so we know there's not that many PAs working in the UK currently compared to the US, but PAs can work across all specialties in healthcare. But most PAs end up working in general practice, and this is because the training that we get is mainly general medicine, and so our sort of scope of work fits nicely within a general practice setting. But as you can see from the table, about 30% of PAs go into general practice. But as you can see, PAs span across all specialties, and what we found is from our work placements, PAs have got a role in sort of the various departments that we've been in, and we can really still see ourselves fitting into the multidisciplinary team quite well. So you do get the option of, if you want to practice in a specialised sort of area, then there are opportunities for you to do that as well. Hopefully there'll be more moving forwards once PAs sort of get a little bit more integrated into the NHS.
So our PA actually works in obstetrics and gynecology. which I think is roughly 1%.
Okay, so a lot of times people sort of ask, well, how is a physician's associate role different to a doctor's? So we're just going to outline some of the key things there. So a key thing to note is that physician associates only provide care and treatment to patients in a supervised setting. So Beth mentioned within our team, we'd be working with a consultant or a specialist doctor. And so we sort of see this as a similar level to supervision that a junior doctor gets. But the levels of supervision will obviously vary depending on whether you're a brand new PA or whether you've been doing PA work for a while and you sort of can work a little bit more independently.
I think as well, once you qualify, some trusts offer a preceptorship package, and so you get that extra little bit of support, obviously when you first qualify, which is you need.
So the scope of practice between a doctor and a PA does vary because our training isn't exactly the same. The two biggest differences between a PA role and a doctor's role at the moment is that PAs currently aren't able to prescribe medications. However, very recently, the physician associate profession is undergoing regulation, and this is with the General Medical Council, the GMC, and the GMC are sort of thinking about changing this and going through the process of maybe changing the legislation so PAs are able to prescribe. With this in mind, with our training, we've had lots of lectures on prescribing. While we're on placement now, we have teaching sessions on pharmacology, therapeutics and prescribing. So we're sort of getting prepared for when the move is made and the physician associate will hopefully be able to prescribe as well. The other thing is requesting ionizing radiation. So currently we're not able to do that. So when we see patients and we decide that perhaps they need a CT scan or something similar, then we'd have to put that through our supervisors to then sort of sign off and say, yeah, this is fine. So we can't do that at the moment either.
So hopefully that will change as well.
Yeah. And then finally, as I've mentioned, PAs, we have sort of a general medicine training. And so what PAs can't do that doctors can is go into specialised training. So we can't become specialists in an area like doctors can become consultants. So that specialist training phase isn't there for PAs visible.
But you could argue, I suppose, if you take a job in a specific area and you really enjoy that area and you want to spend the rest of your career in that area, you could be considered a specialist, although it wouldn't be considered the same as like a specialist consultant, for example.
Also, just on that note, because we don't go into the specialist sort of training, it kind of gives us an advantage of being able to move around a little bit. So yeah, it allows us to kind of try maybe one area of healthcare and then work there for a while and then decide, or maybe want to try a different area, we can sort of switch over to a different area and just sort of work as a PA within the team in that area. So we're not feeling like tied down to, you know, a single route or a single specialism, which I think is a benefit.
Yes.
Okay. And then very quickly, we also get asked why or how a physician associate is different to a nurse. And I think there are lots of duties that we share with nurses and doctors as well, but the key difference is that during PA training, our training is to the medical model as opposed to the training that nurses get. So a lot of our training involves understanding the science of cause and effects of disease, so really looking at the pathology and the science behind it, and then making diagnoses through the sort of pattern of observations and then analysis and then reasoning based on the observations that we've made to then decide an appropriate treatment plan for the patient. Fine. Okay, so if you're thinking about becoming a physician associate, there are sort of a couple of different routes that you can take. So I think me and Beth took this first route, which is an undergraduate degree, so this is normally in a bioscience related subject. However, I think we know of a PA who did a zoology degree and then managed to get onto the physician associate course. So I think it varies between the universities, so just check their entry requirements section, but generally a bioscience related subject. So I did human biology as my first degree.
I did nursing, so if anybody does have any questions about that later, I'd be happy to answer.
And also having some sort of clinical experience helps as well. So obviously Beth had plenty of clinical experience, but I took some work placements at a local hospital to get my clinical experience. And then once you've done your degree, you then apply for a postgraduate course, and this is normally a 2-year postgraduate course in physician associate studies. And universities offer either a master's in medical science, physician associate studies, or a postgraduate diploma. And I've just put here that this is similar, the level of this is similar to a 2nd or 3rd year medical school sort of student. We get lots of clinical training, so these courses usually involve at least 1,600 hours of clinical training. I think that's the minimum requirement for you to qualify.
And all universities they structure their course very differently. So if you are interested in looking, make sure that you do look into that. Our university, we do a full year of theory, and then this 2nd year that we're in now, we do a full year of placement.
And so I found this recently, I didn't realise this existed, but there is a university that offers an undergraduate integrated Masters of Physician Associate Studies, and that's a 4-year course, so you don't need to go through the undergraduate and then postgraduate sort of routes. And the entry requirements are 3 A-levels AVB, including chemistry, similar to medicine, or there's the equivalent qualifications as well, but that option is there, which I think is quite nice. And then where to get more info? So the Royal College of Physicians website. So the Faculty of Physician Associates is currently sort of overseeing the PA profession at the moment. So they've got plenty of information if you'd like some more info. Also, the GMC I mentioned, these are going to be, this is the body that's going to regulate PA, so lots of information on there in terms of what PAs do and the different competencies and things like that. And finally, the NHS has a page on MAPS, so these are medical associate professions, which include physician associates, but also there's the anaesthetist associates as well, which come under that. So yeah, there's plenty of information on there as well if you want to find out some more. And any questions for me and Beth, you're welcome to take any.
I hope they could all hear that.
I did have that panic, and it was like, surely someone would have gone, "You're pretty sound." So, oh yes, they were telling us they could hear it. So, has anyone got any questions so far? While they think about it. So, can I ask? Oh yes, we're typing. Why did you choose? Oh, what made you want to be a PA?
Okay, great question.
So, well, for me, I did mental health nursing as my undergraduate. I don't know why it's just zoomed in on you.
A bit slow.
And I really enjoyed the anatomy and physiology side of things. And with mental health nursing, you're very restricted to working in psychiatry. And although I loved that and I enjoyed that, I really wanted to further my profession and go into the physical health side of things. And I also wanted to go back into education. So when I found out about the physician associate role, it just seemed like everything I wanted. So.
So for me, I think when I did my human biology degree, one of the aspects that I really enjoyed was the clinical application of human biology, but there was only like a really small amount of pathology and diagnosis and things that we did. And so when I graduated, I worked for a bit, but then I decided that I want to go into healthcare. So I looked at the options available. Medicine was one of the options that I considered. but I really didn't want to commit another 5 or 6 years of my life studying. And so I was still really wanting to sort of go into a profession where I would be working with patients and managing disease. And so the physician associate course looked a lot more attractive because of the fact that it was much shorter. But the role itself involves a lot of the things that I really wanted to get into in terms of medicine. So I think the amount of clinical practice, clinical experience that we get on the PA course, for me felt like it was enough for me to feel comfortable to work in a hospital or in a GP setting, and still kind of do some roles similar to that of doctor, but I just found it was more suitable for me in terms of the time frame taken before qualifying and working.
So you're both currently at the University of Sheffield. Why did you choose the University of Sheffield for your PA course?
For me, my mum studied there. It's also a Russell Group university, so that's always a good thing. And it's really close to home for me. I'm in Chesterfield, so it's about a 10-minute drive. Perfect.
So for me, it was one of the highlights of Sheffield was the outdoors, especially the rock climbing kind of facilities that are available here. So I love rock climbing, and Sheffield is like one of the best places in the world for rock climbing. So where I'm living at the moment is very close to all the best like crags and things in Sheffield. So there's the Peak District as well. I think if you're an outdoorsy type person, then you would love Sheffield because it's got some of the most amazing places that you can be around and go and visit when you're not studying. Sometimes I forget that. When I'm studying for an exam or if I've got lots of work on, I always sort of forget that the peaks are just around the corner. So yeah, but yeah.
Yeah, because I think you have to sometimes when you have to think when you're looking at university, all the courses are different, but they are quite similar as well. So you do need to look at why you went to university, why you're choosing that one. I mean, it's not about me, but I knew that I was leaving and I wanted to go as far away from my home as possible. I didn't go that far, but whereas it was close to home. So people are now looking at actually what is available close to home, or what do I want to do outside of my studies. So when you are looking for your university placement, don't necessarily just focus in on the university, see what is around, the countryside, or maybe you want to go to a big city. Well, that doesn't have to be London. There's lots of other big cities and stuff like that. So actually, you made really good points about why you chose Sheffield. What piece of advice would you give your pre-university, to go back before your undergraduate, your pre-university life, what piece of advice would you give now that you're older and have been through?
Oh my goodness. It sounds really cliche, but just believe in yourself. I know that sounds really pathetic, but I think you really do have to, especially in this kind of profession as well. And if you really think hard about what you want to do, because with medicine you kind of do have to dedicate your life to it. But if it's really what you want to do, don't be put off by it. Dedicate yourself, believe in yourself, and you will be able to achieve it.
Oh. Yeah. And I think I'm going to go a bit more practical. But I think that you should sort of think about the type of profession or career you see yourself in. So kind of think where would I want to be in 10 years' time, if you like, and then work backwards to see what steps would be better to get you to where you want to be. And this is because when I decided I wanted to do human biology at university, but that was literally because of the A-levels that I did. I liked biology the best, and that was because my biology teacher was the nicest. So I didn't really think ahead. I just thought of sort of what was going on at the moment, in that moment in time. So I think it would be good for you to think about the type of career you see yourself in, and then look at the different options. And there normally is more than one option to get there. So take some time to look at the different routes that are available to get there. And then having said that, also, I'd probably tell myself, or kind of keep reminding myself that just because I'm applying for this and I'm aiming for this career doesn't mean that's what I'm going to do for life. So I just have in the back of my mind that it's a big decision, but I'm not going to get really fixated on it and focus on the outcome and sort of think about the fact that you can do something, and once you've completed it, there may be other options available for you that open up for you that you weren't aware of before. So just keep that flexible kind of mind frame as well as sort of making sure you've researched all the options of how you can get to where you want to be. I hope that makes sense.
Do you know where you want to be when you finish your course? Do you know what area you want to work in, as in not location-wise, but clinically-wise? Have you thought about that yet?
I think because we're at the beginning of our placement at the moment,
Yeah,
it's quite difficult. But I do like the idea of either odds and gynae, but I'm yet to experience that. So we shall see. But also general practice and GP. We actually had to do a 3-week early clinical exposure, and we did ours in GP. And I just really enjoyed it because you just never know what's going to come through the door, and I love that. And you're on your toes, and you also feel a bit more independent. You still have that supervision, of course, but you have your own little clinic. So you, at the moment, it's a lot of telephone consultations because of COVID, of course. But yeah, you get to kind of be a bit more independent in that, and then report back to your supervisor, and then they give you advice, and yeah, it's pretty good. But like I say, I've got to experience the whole plethora of clinical experiences yet. Same.
Yeah, same. So just going on with what Beth has said, we've had general practice placement already. I really enjoyed that. I liked the community kind of feel and the fact that you can see a patient and a patient's family members, and you can sort of have them as your patients for long periods of time. So it's the holistic care sort of feeling was really attractive for me. But also with our placement, we've got placements across all the specialties. So again, I think once I've sort of tasted what it's like in each specialty, I'll get a better idea. Having said that, yesterday I was on the cardiac cath labs, and it was only one morning, but I felt like it was so exciting. I think it was really interesting, the different technologies and things that are available now that allow you to sort of see the function of the heart to such great detail and sort of see it live happening while the patient's on the bed. So I think the more we get to be in these specialist areas and the more sort of we're exposed to, the better idea we'll get. But yeah, I think at the moment, the general practice placement was really good for me as well. So
That's good. So just for a bit of background on the one PA that we have at the trust, she did a 18-month, what we almost call like a preceptorship. So she did 6 months in O&G, 6 months in surgery, and 6 months in medicine. It might have been a bit skewed with COVID, but that was the plan. And then at the end of that, she got to basically choose which of those specialties she went into. My understanding, that's quite a common thing. If you're going into hospital medicine, you have a little, almost like taster, 12 months, 18 months, and then it's normally like an internal competition to get a job within a specific area. Is it worth mentioning that you have to do an exam every 5 years, is it?
Oh, yeah.
Yes. Sorry, that was on the PowerPoint, but I was doing that. So, yeah, so when you're at the end of the physician associate course, you sit a university-based exam. In fact, there are 2 exams. One is a written exam, and then the other is a practical exam. So the written exam is sort of 200 questions and the case-based questions. And this is very similar in format to the national exams that you do once you've qualified, once you've got your degree. The practical exam is OSCEs, which stands for Objective Structured Clinical. Look at you. Examinations. And so
I didn't even know that. I think used the term OSCE all the time and didn't know what to do.
I don't think I've said it before. But okay. So this is like what happens is there are 8 stations, no, 14 stations, and in each station, you're given a task, and this is a clinical-based task. So it could be, the task could be to take a history from someone, it could be to perform an examination or to perform a clinical skill. So they're quite varied. There will be an assessor in each station who will mark you, and then at the end your scores will be collated and you have to pass a certain number of stations out of 14. So that's the practical exam. And so as I said, you would do that at the end of your university course, and if you've passed that, you then have to do pretty much the exact same thing, but as a national exam. So this is, once you've passed this, you can then be put on the PA register, which shows that you're competent and you've passed those exams and you're now fully qualified to practice. So
I think it's worth mentioning as well, like medical students, they don't have to do that. So at the end of the medical degree, you pass and you go straight into F1, is that right?
Yeah.
But they don't have to do anything like, which I'm not sure why that is, or if I think that's fair, but yeah, just worth mentioning.
Yeah.
Another difference between.
And then I think you have to redo the exams after, and I'm not sure how many years
I
it
think
is.
it's every 9.
That seems very random.
Yeah,
Could
I'm
be.
pretty sure I've read that somewhere. It's 6 or 9. It's random. It is a really random.
I think it's around 6. But you have to keep doing it every so many years so that you can show that you're still competent to practice.
But again, this is something that could change with GMC regulation, because at the moment we're on the it's the Physician Associate Managed Voluntary Register. But when we go over to the GMC, there might be a lot of things that change. So some of this information that we're giving you today could change. So
Thank you. Does anyone have any other questions?
anything at all.
Like 2 sessions. It's clearly too much. Oh, is there anything you're not looking forward to about becoming a PA?
That's a really good question.
Having to go to work?
Okay, I know one thing I'm not looking forward to, and that is getting into a job, and I know there were people there that have never heard of a PA before.
Yeah.
And so, again, we've experienced this already, but people frequently asking, oh, what are you? Like, what do you do?
But also, why don't you want to be a doctor? Oh, why PA, not a nurse? It's like, because I want to be a PA.
So I think that's going to be probably slightly annoying to start with, but I think we're going to get into.
But we get that now, don't we?
Yeah.
So you get trained for that.
Yeah,
I think training.
we're going to have to sort of develop a little speech and then just throw that speech out whenever someone asks us why would it work, do you want to be a doctor or something. So, but I think I'm definitely looking forward to it a lot more than I'm not. I'm really excited about kind of taking on a pioneering role in a way in the NHS. So it's going to be new, it's going to be challenging, but I think it's going to be really exciting because at the moment, I think governments are really encouraging practices to take on PAs to help with the workload and just to become a part of the team. So I think it's really exciting.
It is, definitely.
And like I say, it's definitely growing. There's more.
Yeah.
I know that local hospitals around here have got a lot. Barnsley have got loads. Hull have got loads. It's not something that we've taken up as much in Rotherham.
Yeah.
And I also think, I might be wrong, you might not know yet, but I think the hours are probably a bit more sociable as well than being a doctor. I think it probably will depend on where you're based and what specialty you're in.
Yeah.
But my understanding is it's a lot more 9 to 5 without on-calls and weekends. So, you know, it's something.
Yeah.
I always say this when I do the sixth form programme, you know, when you're at that age, you don't think about your life balance as much because you're not married, you don't have, you know, but it is something to think about, is to take into account an alternative career that is just as rewarding, but yeah, you don't have to work weekends.
Yeah,
Yeah.
definitely.
But the option is to do it if you want to as well.
Yeah,
Which
but
is nice.
that's what I mean, you can have that negotiation,
Yeah.
or you might work a late night, which is like till 8 o'clock rather than overnight, you know.
Yeah.
So it's not a given, but I think it's more typical
Yeah.
that it's a, I would say a nicer work-life balance, but
Yeah.
I work in an office. Any more questions before we let the lovely ladies go back to being patients? Well, thank you both of you. There were some very useful areas to look at, websites to look at, and I think hopefully it's given people some thoughts for, like I say, for a career that